The Insight CBT Partnership is a new company formed this year to help deliver CBT of schizophrenia training on a national and international basis. The original Insight project took place starting in the year 2000. At that time, there were a number of expert cognitive therapists who were proving that you could significantly help patients with schizophrenia by using cognitive therapy. However, our view was that to help the great mass of people with these illnesses who weren't in clinical trials, we had to train normal mental health professionals in how to use the techniques. We therefore delivered a training package over 10 days, and with the use of supervision, we proved that mental health professionals could use the techniques to deliver a really quite decent benefit to their patients with schizophrenia and other psychoses. We have come now, having proven the effectiveness of the intervention, to try and deliver it through a whole range of training courses. These would include organised 1 and 2 day introductory programs and 5 and 10 day brief training programs. These are to be backed up with supervision. It is our view that every member of the mental health team has a quite specific role to play in terms of the delivery of this effective intervention. First of all, consultant psychiatrists and mental health nurses with very large caseloads can deliver a variety of what we might call more superficial cognitive behavioural techniques. These would include techniques like being able to engage the psychotic patient a bit better, using questioning and normalising techniques, and using some basic techniques to improve adherence and to help with relapse prevention. It is also our view that the reality testing of voices and delusions can begin in the consulting room or the day hospital using a variety of easy to teach behavioural experiments and other techniques. Our view is that community mental health nurses with smaller caseloads, perhaps in early intervention and psychosis teams, can deliver much more in the community. This might include much fuller case formulations and perhaps doing more complicated behavioural homework exercises. But that would never be enough. And it is our view there must be expert cognitive therapists. These will be clinical psychologists or consultant psychotherapists with appropriate training or expert nurse cognitive therapists. These will take patients who have received the techniques and who need more. These might be cases with comorbidity, such as post-traumatic stress or personality disorders, or who are also abusing amphetamine and other substances. They are clearly more complex formulations and need longer therapy, including schema level and metacognitive interventions. So in this master plan, we would hope to deliver training across these different groups. On the website, which this is the introduction to, there will be a vast array of different materials to help with the training. There will be a whole variety of lecture courses. There will be homework, experiment sheets. There will be patient information sheets. There will be a variety of case studies. There will be chat rooms and discussion sites. It is our view that with this vast array of rich information gathered together on the one site, that you will be able to much more effectively do your own cognitive therapy with your patients with psychosis, but also to train the teams of the people that you work with. So I hope this website is enjoyable, and we will welcome feedback at any point for ways in which we can improve and develop the content. You liked it?
Yeah.
Thank you, that was the only applause I got.